I've been in the healing profession a long time, and I think it is absolutely vital that this kind of care, or somebody that has the ability to give this kind of care, is here to help a loved one or a patient. I think the healing process goes much faster, and just in my personal experience, I wouldn't have it any other way.
Well, this is a lot more in depth, and so it's a lot more helpful.
Good.
Yeah.
One of the most helpful things about this whole healing process was that I was able to meet immediate comfort needs. I could go and get him some ice chips, or I could help him get to the bathroom, or when he was able to swallow, I could get him some pudding. The nurses could have done this, but we didn't want to bother the nurses. They were dealing with more important things. So we just were able to, I was able to help him get those immediate, more like comfort items, and just help him with his bed or whatever. But I think being trained to unplug his tubes and be able to get him up and moving. We went for many walks every day.
I think that was huge for me, to be able to have her partner with me in getting out.
With the Partners in Healing program, there are so many things. The most important thing I think there is for people to understand why you're doing what you're doing. So when you're teaching that patient to use the incentive spirometer, if you turn around and look at the family members, they're listening and they're taking it in. And you show them how to do that, and the family members listen. You explain to them on a very basic level why it is so important that their lungs be re-expanded and they're able to clean out all of the garbage that's in their lungs after surgery. Also, it's with pain medication. You explain on a very basic level to the family members and to the patient, pain medication is very important in the healing process. If the patient is in a lot of pain, then that releases cortisol. It causes blood pressure to be high. The patient doesn't breathe very well. So as you're teaching the patient, you're also teaching family members why this is so important. And then if they understand, people understand what you ask them to do, they'll do it, but they have to understand. So you have to explain to everybody, the patient and the family members, why you want them to do what you're asking them to do.